Hello, I'm Dr. Brian Gibson, and tonight I want to talk to you about causes of peripheral neuropathy. So when it comes to peripheral neuropathy, it is important that you determine the cause. So often, you're going to be given the diagnosis of peripheral neuropathy without a reason. And they may say, well, you've got to have diabetes, and they test diabetes and it's negative. Or you may have diabetes and they say, well, that's your cause of your peripheral neuropathy. Or they may literally not give you a cause at all and just say it's idiopathic. We don't know what's causing it, but you have it and you're going to be stuck with this for the rest of your life. There is a great value, a great benefit to knowing what your peripheral neuropathy is caused by. And that value is, if you know the cause, you can treat it. If you have a vitamin deficiency, for example, you're not getting enough of a certain type of vitamin, a certain type of nutrient, if you can fix that, you're treating your peripheral neuropathy and you're improving the functioning of those nerves. So it is imperative that you learn the cause of your peripheral neuropathy, and most of the time that's not done. So let me give you 4 keys to helping you understand what the cause is of your peripheral neuropathy. Number 1, not all peripheral neuropathy is caused by diabetes. Diabetes is one of 150 or more possible causes of peripheral neuropathy. I used to say 125. We're now finding that there's even more than that causes, so we've raised it to 150 as the usual or largest number of causes of peripheral neuropathy. Number 2, you can have more than one cause. So just because you have diabetes doesn't mean that's the only reason you have peripheral neuropathy. And a lot of times, some of the other causes of your peripheral neuropathy are easier to treat, say, than the diabetes itself. Number 3, increasing the health of your body, even if you don't completely know the cause of your peripheral neuropathy, improving your health will improve your peripheral neuropathy a great deal. And number 4, every individual has a cause of their peripheral neuropathy. Idiopathic is a cause that I don't like to use, because what that means is we don't know. Because there is nothing that doesn't have a real cause. Your cause may be genetic, your cause may be inflammatory, your cause may be autoimmune, your cause may be diabetes or a systemic disease, your cause may be cancer or cancer treatment, your cause may be vitamin deficiency or vitamin dependency, your cause may be other nutrients, their cause may be traumatic injury. I mean, the cause may be toxic, especially stuff like alcohol or certain medications, even some antibiotics. I mean, the truth is, you've got to know the cause. And when you're given the diagnosis of idiopathic peripheral neuropathy, they're basically saying, we don't know the cause. And so what they've also done is they've cut your legs out from underneath you, saying, okay, there's nothing you can do for it because we don't know why it happened. So if you went to the doctor, for example, and you were having chest pain, and you were having pretty significant chest pain, and sometimes the chest pain would feel like you had an elephant standing on your chest. You may feel like there's pain going down the arm, radiating down the arm, or it goes up to the left jaw, and you're going, okay, I think I'm having a heart attack. And they do an evaluation, and your heart is 100% completely normal as far as their evaluation says, well, we're not sure why you're having pain. We think you should go have surgery and get a bypass because you must be having a heart attack. How many of you would allow them to do a bypass surgery without knowing what vessels needed to be bypassed? Nobody. You're not that crazy. But at the same time, when it comes to peripheral neuropathy, we accept the diagnosis of idiopathic peripheral neuropathy and just assume that means that we can never treat it. So what I want to tell you is idiopathic peripheral neuropathy is a diagnosis, meaning we haven't yet figured out your cause, because there's always a cause. So I'm Dr. Brant Gibson, and my recommendation is that you should determine the cause of your peripheral neuropathy so you can start moving forward on the treatment options. This is Dr. Grant Gibson, and this is Neuropathy Nugget Day 214. Determine the cause of peripheral neuropathy so that you can treat it and so that you can truly manage